Hi, my name is Chris Edmonds. I'm the In One Place Programme Manager. In One Place is a unique collaboration between Aneurin Bevan Health Board, the 5 local authorities that make up Gwent, and 8 housing associations. And the sole purpose of that is to provide accommodation alternatives to people who would ordinarily spend a long time in institutions. This particular project here in Brinteg Road was brought to us by United Welsh, and working with our social services partners here in Blaenau Gwent and the Health Board and the local community mental health team, we put together a plan to develop this into tenancies for people who've been in long-term mental health institutions. One of the unique parts of this is being able to fund and support people who would ordinarily spend most of their lives in institutions. One of the success stories of this particular project is Mark, who will tell you the story of how his life has hopefully transformed for the better from moving from institutional based care to having his own property.
Right then, Mark, so kind of tell us a little bit about your journey, where you've come from, if you don't mind, before you came to Brinteg Road.
I was moved around different hospitals, Antigua, Rhondda, Pastoral Cameron. I went to a lot of different places.
How did that feel, being like passed around, I suppose, the system?
You couldn't settle really, and
how long were you on there in total, on the wards?
over 8 years.
What were the wards like then?
They were alright, like, but they were like hospitals, and you had to share most of the things with people, and like you and I got my own kitchen. If I leave a mess, I got to clean it up.
Yeah.
They just leave it off them, and I'd end up cleaning it up.
That can't be nice. Okay. Do you want to talk a little bit about some of the achievements you've done since you were there? What were you up to?
We've done some DIY. Had to put this chair up there, table up, curtains and rails, and we put a rail in this cupboard by here, my clothes.
You did?
Is that something you've done before, Mark? Was the DIY?
No, I never done that.
No? And what else have you been doing in the garden? You've been doing quite a bit in the garden, haven't we?
We mowed the lawn, didn't we?
Yeah.
Took all the bricks out, and
yeah. And what's our big, mine and your big achievement in the last, I suppose, week or so that we're quite proud of?
Bird boxes, isn't it?
Yeah, bird boxes. And what's the result of the bird boxes being made?
People in the community want some, don't they, now?
Yeah. So our orders are coming thick and fast then, if you like.
All the pressure now, Mark. We're going to have to keep making them. Supply and demand.
When he first came here, I was a bit weary. I didn't know what to expect, because Mark have always been in hospital, which he didn't have no goals, nothing. He was just in hospital, walking up and down the corridors, or just going out into the community now and again with staff and that. And when he was coming here, it's so different. He got his place, which he always wanted. He's a different boy. I've had a lot to do with Mark, trying to get him into hospitals. And when he said they wanted to go in the community, I thought he'd never do it. With all the staff, they're beautiful. I'd think of it as his family. It's like brothers and sisters perhaps to him. To me, I come down here and I think it's a family, but I don't know them all. And they just treat me so well, and they treat Mark so well. I can't believe that he's in here